Hello, Liberty University students and faculty. This is a brief overview of my practicum completed summer 2015 for Health 698. Let's stop now. Smoking and trauma orthopedic patients pilot. During this practicum, I assisted the clinical specialist at the clinic as a student assistant, educating patients in the control group on the health and benefits of quitting tobacco using the Maryland Tobacco Quit line. Next slide. The Maryland Department of Health and Mental Hygiene's Center for Tobacco Prevention and Control, hereinafter referred to as CTPC, goal is to engage healthcare systems to improve the delivery of guideline concordant care for tobacco dependents through systems and policy change. CTPC decided to partner with the Orthopedic Trauma Department at the University of Maryland, Baltimore to implement a smoking cessation pilot to screen patients for tobacco, provide brief counseling on quitting, and making referrals to the Maryland Tobacco Quit line. CTPC has successfully managed the Quit line since 2006 with a 98% customer satisfaction rate. The Quit line provides free evidence-based telephone, web, and text counseling to Marylanders 13 years of age and older. These people who participate in this program also have the advantage of having free nicotine replacement therapy shipped to their homes for 12 weeks. Next slide. The overall purpose of this study is to determine if patients with similar injuries who smoke cigarettes are willing to quit tobacco. CTPC hopes to mirror this study in other healthcare organizations throughout the state of Maryland so they can have policies in place to help patients quit tobacco, a referral mechanism in place to the Quit line, and have more healthcare organizations screen patients for tobacco use. In addition, CTPC hopes that other healthcare organizations provide training to their staff so they can provide brief tobacco interventions to the patients they treat. Together, all of these can support state quit line capacity and increase quit rates throughout the state of Maryland. Next slide. The Orthopedic Trauma Department clinical environment at the University of Maryland, Baltimore creates a unique opportunity in which patients are hospitalized and followed up with fairly regular intervals following discharge as a standard of care. Patients who consent to the study are first asked questions about their smoking habits, had their exhaled carbon monoxide measured to assess when they last smoked a cigarette, given and gone over with local smoking cessation resources, as well as information on the Maryland Tobacco Quit line, and encouraged to use local resources offered to them. Lastly, they are assigned at random to one of three groups. The first group was the control group, which I had the pleasure of educating on the Maryland Tobacco Quit line, as well as local resources offered by the state and city local health departments. I will go over with these patients all of the benefits of quitting smoking, the cost benefits, as well as answered any questions they may have had about the Maryland Tobacco Quit line. The second group was the counseling group. In this group, the patients received the Quit line brochure as well as a 10 to 30 minute discussion about smoking from a smoking educator. The third group was the counseling and follow-up group. Now this group received the Quit line brochure, a 10 to 30 minute discussion from a smoking educator. In addition, this group received a follow-up phone call from the smoking educator or a visit from the smoking educator at their second appointment at the clinic. And the follow-up phone call or the in-person visit would just check in with them about their progress on quitting tobacco. If the patient was still struggling, the smoking educator will offer them other local resources they could take advantage of and provide more discussion on what their troubles are in quitting tobacco and offer them feedback on how they can overcome those. Next slide. By the close of the practicum, a total of 44 patients were enrolled in the study. 26 of those participated in the Facts to Assist program. And in the Facts to Assist program, I would go to the patient once they consented, have them fill out a form with their contact information. I would then fax those forms to the quit line. A quit line counselor would then contact those patients and enroll them in services. 9 of the fax referrals out of the 26 accepted services. This means they accepted for a counselor to call them and also accepted free nicotine replacement therapy mailed to their home for up to 12 weeks. In addition, one participant participated in the Quit Line's Web Coach program. This is where this participant will receive all of their counseling and motivation via web. Next slide. Recommendations for CTPC that I have would be to continue to build key partnerships with other healthcare organizations within the state of Maryland to articulate that quit line referral systems are best practices. For example, another huge healthcare organization within the state of Maryland is Johns Hopkins Healthcare System. This is a healthcare system that is known all over the world and treat patients from all over the state of Maryland. And all of those patients treated who are smokers could benefit from services provided by the Maryland Tobacco Quit Line. Second recommendation is to engage healthcare systems to improve guidelines for tobacco dependence and for CTPC to build similar partnerships with other clinics throughout the state of Maryland that serve patients with diabetes, heart disease, hypertension, as well as OBGYN patients. All of these patients can benefit, if they are smokers, from services provided by the Maryland Tobacco Quit Line. I hope you enjoyed my presentation on my brief overview of the Let's Stop Now smoking cessation pilot that I participated in this summer for Health 698. And if you know anyone who is struggling with quitting tobacco, please refer them to call 1-800-QUIT-NOW, which is a nationwide number. Once they call that number, counselors from that phone number will refer them to a quit line in their state. And if not, they can also receive services from 1-800-QUIT-NOW. Thank you and have a great evening.